When an unintended pregnancy needs to be terminated, a safe abortion is vital in ensuring a woman's health and well-being. Safe Abort Kit helps in safe abortion. The Safe Abort Kit should not be used after 9 weeks of pregnancy, 63 days counting from the first day of last menstrual period. Now let us see how to use Safe Abort Kit. Safe Abort Kit contains 5 pills. On day 1, take 1 pill of mifepristone with water. If you vomit within half an hour, buy a new pack and take the day 1 pill. After taking this pill, you should expect some vaginal bleeding and lower abdominal pain. Within 24 to 48 hours of taking mifepristone day 1 pill, take 4 pills of misoprostol together. You can choose any of the following 3 methods. Method 1. Keep all the 4 pills under the tongue and hold for 20 minutes before swallowing the pills. Method 2. Keep 2 pills on either side between your cheeks and teeth for 20 minutes and then swallow the pills. Method 3. Insert 4 pills deep inside the vagina and lie down for half an hour. After taking the 4 pills, you should expect an increase in bleeding and pain. This will seem like a heavier and more painful menstrual period. You may have to take painkillers like ibuprofen to relieve the pain. You will pass blood clots and may have some vomiting, loose stools, slight fever with chills, headache and dizziness. You should drink a lot of fluids and rest as much as you can. After the blood clots are expelled, pain and bleeding will reduce. Bleeding may continue on and off for up to 14 days. After 14 days of taking mifepristone day 1 pill, you must visit a doctor and confirm if the abortion is complete. Contact your doctor immediately if you experience heavy bleeding, that is, 4 thick sanitary pads soaked with blood in 2 hours, unbearable abdominal pain, persistent diarrhea and vomiting, high fever above 101 degrees Fahrenheit lasting more than a day. Medical abortion process is complete after you have experienced bleeding and pain and have passed large clots or clumps of tissue. Bleeding will decrease gradually over time. If there is no or only slight bleeding several days after taking misoprostol pills and you continue to have symptoms of pregnancy, then you should contact the doctor immediately.